You're about to learn how to operate an amazing new patient transfer system, the Barton. It allows you, a single caregiver, to transfer patients from bed to chair and back into bed again, easily, comfortably, and most importantly, safely, for both patient and caregiver.
Many of the traditional methods of transferring patients to and from their beds have become outdated, and in many cases can be potentially dangerous to both patient and caregiver. Whether you're trying to physically lift a patient out of bed or using a sling-type lift, the potential of injury is well documented for putting tremendous stress and strain on the patient, as well as affecting the safety of the caregiver.
Regardless of the patient's size or number of people assisting, caregivers are often at great risk of injuring their backs while attempting to physically lift a patient. It's no wonder OSHA ranks healthcare professionals at the top of the list of jobs in America with the highest number of reported incidents of back-related injuries. You're about to see how the Barton will make your job safer, easier, and better for your patient.
Additionally, there are many patients with conditions where unnecessary, disruptive, and often painful physical and/or sling contact during transfers can limit the caregiver's ability to move a patient without the potential of further injury. Painful conditions such as bed sores, multiple sclerosis, chronic arthritis, and osteoporosis have increased potential of further injury and pain when attempting to lift the patient into and out of bed. That is, until the Barton.
Following the easy instructions, you'll learn how the Barton patient transfer systems allow you, the caregiver, to efficiently transfer any patient, even those weighing up to 660 pounds. The Barton allows you to transfer patients safely and without the time-consuming disruptive task of trying to assemble a team of caregivers or log rolling your patient in order to attach a sling. Here's how easily the Barton works. Bed to chair transfer.
First, make sure you have the following components of the Barton patient transfer system available near your patient. 1. A Barton transfer chair that is appropriate for your patient's size and medical conditions. This is accomplished by noting the patient's weight and the width of their hips.
2. A Barton transfer bar.
3. 5 Velcro transfer straps with clips.
4. 2 chair brackets, if they are not attached to the model of chair you have chosen.
5. 2 bed brackets and 2 bed clamps to attach to the bed if it is not already set up for transfer.
Attaching the transfer straps. First, assess the patient's bed before you begin the transfer. If not already done, you may want at this time to also attach the bed brackets and bed clamps, if needed, to the patient's bed on the opposite side of the bed that you are going to transfer from. This will allow the patient's bed to be set up to transfer the patient back into bed when the time is appropriate. If the bed has IV pole sockets, use the IV brackets by simply slipping the bed bracket posts into the IV socket openings. If your bed does not have IV sockets, you will need to first attach 2 bed clamps to the head and foot of the bed. Do this by aligning each clamp with the mattress and tightening the hand screw so that a clamp is secured to both the headboard and footboard of the bed. Once the clamps are attached, insert the bed brackets into the square openings on the clamps. Next, gather the transfer straps and ensure each strap has a sheet clip securely attached to one end. If the clips are not attached, please refer to the operating manual for easy instruction. Go to the patient's bedside and release the patient's bottom sheet from all 4 corners of the mattress so the sheet is unobstructed.
Locate yourself on the side of the bed that you're transferring the patient from. Fold or roll the detached bottom sheet so that it is folded lengthwise and closely along the patient's body. If your patient utilizes an underpad, you can still transfer the patient leaving the pad in place.
Starting at the patient's shoulders, take one of the straps and position the sheet clip so that the rubber stopper is placed under the rolled sheet, and that the plastic clip portion is placed over the folded sheet. Make sure that the stopper and clip are in contact with a single layer of sheet and positioned close to the patient. Push the stopper and sheet up through the opening in the plastic clip. Firmly tug the clip toward you so that the stopper and sheet are secured to the clip. Once the clip is attached to the sheet, double the free end of the strap and attach it to the Velcro so the strap is not touching the floor.
Repeat this step with other straps by placing the clips at the hip, buttock, and calf. For heavier patients, a strap may also be located between shoulders and waist.
Positioning the Barton chair. Position the Barton chair as close to the patient's bed as possible. Position the head of the chair at the head of the patient's bed and align the seat of the Barton chair with the patient's hips and buttocks. Once the chair is positioned, lock the casters by depressing either the central locking mechanism or the 4 individual wheel locks with your foot.
With the chair locked right next to the patient's bed, lower the Barton into the stretcher position by squeezing the handle located behind the headrest and lowering the head of the chair until it stops. Release the handle. If your patient is tall, the length of the chair can be extended by loosening the handle in the middle of the back of the chair and extending the headrest to the desired length. Once at the desired length, re-tighten the handle. This step can be repeated to extend the footrest.
Positioning the bed. Once the Barton is in place next to the bed, note the height of the mattress in relation to the Barton. The mattress must be positioned approximately 2 inches higher than the Barton. Raise or lower the bed to achieve this placement. Preparing the transfer brackets.
If you're using an Atlas or Atlas Plus chair that has built-in chair brackets, locate the chair brackets on the outside of the chair. Grip the plastic collar of the transfer brackets located at the head and the foot of the chair. Pull each bracket out and rotate it so that the bracket is pointing upward.
Next, grip the top of the chair bracket, pulling upward and rotating the top of the bracket so that the bracket is facing away from the patient. Repeat this step so that both the head and foot brackets are positioned the same. If you are not using a chair with built-in chair brackets, such as the Barton convertible, locate the 2 L-shaped chair brackets. Insert them into the square openings located at the foot and head of the chair. The U-shaped brackets should be facing upward and positioned away from the patient. Attaching the transfer bar.
Take the Barton transfer bar and place one end into a chair bracket. The transfer bar should be placed so that the end with the built-in handle is at the end of the bed with the most room, usually the foot, from which you'll perform the transfer. Depress the 2 silver buttons located on the transfer bar and extend the bar the length of the chair, placing the other end into the remaining chair bracket.
Preparing to transfer. With the bar in place, locate one of the transfer straps attached to the patient's sheet. Extend the strap. Locate the corresponding slot on the transfer bar and push the end of the strap through the opening starting from underneath. Firmly extend the strap to create tension and secure the end to the strap using the Velcro. Repeat this for all the straps so that all straps have equal tension along the bar and are at a right angle to the bar. Retighten any strap that appears loosely fitted. Transferring your patient.
With all the transfer straps securely attached to the transfer bar, locate the built-in handle at one end of the transfer bar. Firmly grip the knob and pull the handle out, extending it until it stops. Bend the handle at the hinges so that it forms an L. Facing the patient, firmly place one hand on the transfer bracket and the other hand on the transfer handle. Visually check your patient and inform them that you're going to begin the transfer. With a firm grip on the handle, bend your knees and turn the handle so that the straps wrap themselves over the top of the transfer bar. With a steady and constant motion, continue turning the handle until the patient has been completely transferred and positioned in the middle of the Barton chair.
A smooth, steady motion works best. It is important that you do not release the handle during or immediately after the transfer, as tension has built up in the tightened straps and the handle could recoil. When the transfer is completed, without letting go of the handle, Turn the handle 1/2 turn backward to release any tension. Straighten the handle and gently push it back into the transfer bar for storage. Moving your patient.
With the handle replaced back in the transfer bar, release the sheet clips from the patient's sheet. Once the clips are released, raise the side rails on the Barton until they lock into position. Remove the transfer bar from the chair brackets. Walk the bar in an upright, vertical position over to the opposite side of the patient's bed and place it into the bed brackets. This prepares the bed for the patient's return transfer.
Next, lower the footrest to support the patient's feet. Then squeeze the handle located under the headrest.
It is important to note that the Barton chair is counterbalanced and the patient's own weight will assist in raising the chair into the sitting position. Bend your knees and begin to raise the head of the chair, slowly raising your patient.
Release the handle at the desired position. The patient's weight will help position them in the seat and orient them to sitting up. You may adjust the sitting angle to make your patient comfortable. Once in the sitting position, lower the side rails by releasing the knob located on the rail. If desired, you can now elevate the footrest for additional patient comfort. To do this, depress the handle located under the footrest and lift upward. Many Barton chairs also have adjustable headrests and safety belts if required. That's all it takes. With a little practice, you can transfer your patient in no more than a few minutes. Transferring your patient back into bed.
You can transfer your patient back into bed from the Barton as quickly and safely as you transferred them out. First, make sure there are bed brackets and a transfer bar attached to the patient's bed opposite the side you are transferring from.
Remove the straps from the transfer bar and have them available close to the patient in the Barton chair.
Next, recline the Barton by squeezing the handle under the headrest and slowly lower the chair back to an approximate 45-degree angle.
On the side of the chair that you are transferring from, follow the same procedure of rolling the patient's sheet and attaching the clips as before.
Once the straps are attached near the patient's shoulder, hip, buttock, and calf, roll the Barton directly next to the bed and lock the casters. Raise the side rail on the outside of the chair for patient safety and move to the head of the chair.
Fully lower the chair to the stretcher position. Lay the footrest flat for the return transfer. With the chair locked and positioned next to the bed, check the mattress height in relation to the chair. If necessary, raise or lower the bed so that the mattress is even or slightly lower than the surface of the Barton chair.
Go to the side of the patient's bed where the transfer bar is attached. Attach the transfer straps to the transfer bar and adjust them securely, following the same method you used to transfer the patient out of bed.
Locate the built-in transfer handle on the bar at the foot of the patient's bed. Extend the handle and prepare your patient for transfer. Use the same smooth and constant turning motion, ensuring that the straps go over the top of the transfer bar.
Continue the transfer until the patient is positioned in the middle of their bed. Return the transfer handle into the transfer bar. Remove the clips from the patient's sheet and reattach the sheet to the mattress. You can now release the brakes on the Barton and move it to another patient.
The Barton Patient Transfer System is designed to help make transferring your patient easier, quicker, more efficient, and best of all, safer. Both you and your patient will benefit from this innovative technology. Should you have any comments concerning the Barton's operation, please contact your Barton representative.